Okay, we should be live. Everybody, I first want to just ask everybody, when Dr. Nass starts talking, let us know about her audio levels. All right, Dr. Nass, we're going to talk. We're going to talk about the WHO and the UN. This is one of your specialties. This is something they just posted. WHO welcomes historic commitment by world leaders for greater collaboration, governance, and investment to prevent, prepare for, and respond to future pandemics. This is from September 2023. There's a lot here. Probably what everybody is guessing is true, but I wanted to just scroll down really fast to the part that caught my attention as somebody who does the online podcasting stuff. They want to take measures to counter and address the negative impacts of health-related misinformation, disinformation, hate speech, and stigmatization, especially on social media platforms, on people's physical and mental health, including countering vaccine hesitancy in the context of pandemic prevention. Okay, I'm throwing it to you, but I'm going to just give you this first caveat. I forgot to tell you before we went live. We are live on YouTube. So let's talk about this for like 10 minutes, and we're going to then cut the YouTube stream and continue elsewhere. But we're not doing that to evade censorship. We are just doing it because we like it better on the other platforms. We just think they work better. Our friends are there. It has nothing to do with evading censorship, just putting that out for the YouTube overlords. This is not me trying to get around the system. This is just because we just like it better on the other platforms. Okay, Dr. Nass, give us this sort of overview here. Like, we've been hearing about this pandemic treaty and everything for a while. Obviously, a lot of it has to do with messaging. What's going on there?
Okay, so the UN is having its annual meeting this week, and at the annual meeting, they're talking about the Sustainable Development Goals, which are halfway to their 2030 goal of having them all come into play, come to pass. And so they did 2 days on that. Then they spent a day on Wednesday about the pandemic preparedness plan. And what this was the UN trying to provide support to the WHO in the 2 documents that the WHO is drafting to have a pandemic plan that could be run by the WHO in the future. So if we have pandemics, the WHO Director General will declare them. He will declare a public health emergency of international concern, and then that will give him a lot of powers to control what happens, to take medicines from one country and move them to another country, to tell us what medicines we can and can't have, to demand surveillance of our social media so only the WHO message gets out, and many other things. Now, so in order to do that, the WHO has created 2 documents. Now, one is a totally new pandemic treaty. And in order to confuse everybody, they don't call it a pandemic treaty. Sometimes they do, but they usually call it a pandemic accord or an instrument or an other. There are many names.
And Dr. Nass, real fast, like, as you're defining all this, can you respond to how the media often fact checks this and says, like, it's not a binding thing. It's not going to have any, real direct influence. The United States can do whatever it wants. It's not. Could you respond to that as you're defining the terms here?
Sure. So as I said, the first document is a pandemic treaty. The WHO has never had one before. They're working on it. This is being written both by the bureaucrats at the WHO and by the nation states that are members. This is definitely a binding treaty. It says so. It says that the nations need to comply. They have, quote unquote, accountability. They have to report back to the WHO about how well they are complying with the provisions in the treaty. Now, it's very hard for the nations to say we're going to comply, we're going to be bound, that this will be international law that we will be bound by, because good parts of the treaty as it currently stands in draft form are blank, are unspecified. So the treaty says we're going to form a conference of the parties in the future. They're going to decide on their own rules of conduct, and they will make determinations about how we're going to move forward. So at least at this point, they're asking countries to sign on to something that doesn't exist yet, where you don't know what you're going to be forced to do in the future. Okay, that's one document. The second
So far,
document,
how are these countries responding to this? Is everybody just like, great, awesome, we'll sign whatever you want? Like when the guy came to me at, I don't remember. I ended up doing my last birth naturally, but I'll be honest, I gave up the last like 10 minutes or so because they just kind of left me, and I was like, I can't do this anymore, and I was ready to push, but they had left me basically, and so I was sitting there like, okay, if I do this for another 7 hours, I can't do this anymore. So when the nurse anesthetist came in, he hands me the form. And he's like, well, you want me to read you all this? And I said, no, sign it. Just give me that freaking epidural, you know? Anyway, it was too late. I ended up having to just push, which was good. I'm glad for that. But is that kind of, they're just like, sure, we'll sign wherever you want, like how I was at the end of my labor.
yes. So that is exactly how the nations were to start with, before some of the worst provisions got put in, because there's been multiple drafts. So at first, the poorer nations were told, we're going to give you lots of money. You're going to be able to build up your healthcare system, and you'll be able to do all this great stuff. You'll be able to perform surveillance for potential pandemic pathogens. And when you find them, you can sell them to us. You'll make a lot of money. So that was the deal. But as more drafts have come forward, it looks like we're actually saying, there's going to be a lot more biological weapons developed. There's going to be a lot more genomics. Nations are going to have to surveil, as I said, their country's media and censor them. They're being required by this treaty to censor their own media. And the money for healthcare looks like it's only mostly money for very specific things, like training healthcare personnel how to deal with emergencies, not training them in primary care.
Mm.
And the two areas that are particularly desirable for these international organizations like the UN and the WHO, they want mental health care, which is very interesting, and they want reproductive health care and sexual health care. So that's what they're emphasizing, basically birth control and the ability to give psychoactive pills to people who are depressed or anxious, which may make them easier to control.
How does, real fast, how does like a treaty or an accord like this affect someone in the United States who allegedly, I say this very loosely, allegedly has First Amendment rights? Now we're seeing lawsuits being filed against the government for pressuring the tech companies to suppress speech. But if there's a treaty, like a national or international treaty or something, do they get out of having to? I mean, what happens to the First Amendment, I guess, in the case of like, well, we have this agreement with the United Nations. Sorry. I mean, what happens to
Right.
our recourse?
So that's complicated because nobody knows the answer for sure. But this is what we do know. The federal government is trying to destroy the First Amendment. That is why the Missouri v. Biden case is now in front of the Supreme Court, because the federal government has disputed two lower courts, Doughty's court in Louisiana and the Fifth Circuit, both of which, put injunctions on different agencies of the federal government communicating with social media to suppress speech. So the federal government is doing its best to get around the First Amendment. So I'm not sure we even have it anymore. We'll see when the Supreme Court rules. And they may actually come out with something today about whether they will allow the injunction against these federal agencies to continue, or whether they will stay the injunction pending the final resolution of this court case.
Okay, I cut you
Okay.
off. I'm sorry. You were starting to talk about being easier to control with the medications and the other
Yeah.
parts of this.
Well, let me also say that, so according to 3 prior Supreme Court cases, international law supersedes federal law. So that's a problem. Although we like to think that our Constitution totally protects us, it may not. It's a question of whether the Biden administration wants our Constitution to protect us, or is very happy to say, no, international law takes precedence, and that's what we're going to follow. You can't overturn those sorts of decisions quickly. It takes years, fighting in the courts, and then the next appeals court, and then the next court. So our problem is that we have a
Yeah.
president who we don't even know who's running the country, because certainly our president doesn't have enough brain power to do it. So who's making the decisions, and what decisions those people are going to make, and how do we influence them when we don't even know who they are? Is a problem. Okay.
Which is a feature. It's not a bug. The Biden administration it's a feature. I mean, like his coherence is a feature. I believe anyway. I don't believe that's a bug. I don't think they're sitting there like, oh man, we should have picked somebody who was with it
Right.
more.
No, you're exactly right. I mean, if you are the deep state, if you are the people who want to run the show, it's a lot easier when you have a president who is not capable of, pushing back. So anyway, what the nations appear to have been promised and what is actually in the treaty in writing is not the same thing. And so now nations are pushing back. And it's not at all a done deal that this treaty is going to be passed. It requires a 2/3 vote of the 194 members of the World Health Assembly, the members of the WHO, and it will be voted on in May unless the people putting it forward, like the United States and the WHO leaders, unless they withhold it because they've already counted the votes and they see they can't make it. Okay, so that's happening in May, and there are ways we can potentially fight back. For example, in our Constitution, it says that powers that are not given to the federal government are reserved for the states and the people. That's the 10th Amendment. And so healthcare is one of those things that was not turned over to the federal government. In fact, there was a big issue when the federal government started Medicare and Medicaid that they didn't have the authority to do that, right? Because it was a state issue, not a federal issue. So the states potentially can tell the Biden administration, look, you do not have authority for healthcare, so you can't turn over my state's healthcare to the WHO. And that is very interesting. That might win, and people need to contact their local, state, et cetera, even their federal representatives and tell them this is very important. Get the attorney general and the governor to fight back. Okay. There's another document, and that's a pre-existing document called the International Health Regulations. And the US government started a process by which it would be considerably amended. Started this 2 years ago, and other nations have joined in. So 300 potential amendments to this document have been submitted. And again, the WHO bureaucracy is working on them, trying to harmonize them, and has other committees working to create a new document. So the international health regulations as they stand will be very different than what they are now. They are binding in the drafts that have come out. This document has removed human rights protections from its language that is there now, but the new drafts have removed it. Interestingly, the pandemic treaty in its latest draft added them back in to the treaty, but not to the international health regulations, presumably because so many people had complained that they had been removed. The international health regulations sort of overlap with the treaty, so they have similar provisions, but not exactly the same. The treaty will be more focused on getting lots of money to pay for all the new laboratories, the new genomics, the new everything the new computer systems that are part of what they call the global biosecurity agenda, which this is all about. All right, so what happened at the UN was an effort to shore up the diminution of enthusiasm for these WHO documents, because once people find out what's really in them and what the plan is, which is basically to gain much more central control over us and our governments in the name of public health, people don't like it. So there is waning enthusiasm, and the UN was trying to drum up enthusiasm and get each country to go along by creating something they said was a silence procedure. And that meant the UN bureau, the UN bureaucrats created 13 pages of gobbledygook, basically saying we support the WHO efforts. And they wanted nobody to issue a challenge to that document ahead of time. and then they would claim that it was accepted by consensus of the 196, I think, I can't remember how many member nations of the UN, maybe 193. That was stopped. 11 nations together wrote a letter last week and said, we don't go along with this. We don't like it. Your process isn't inclusive. It's not transparent. It's not what you said it was going to be.
What countries?
So Cuba, Russia, Bolivia, Nicaragua, Venezuela.
That's
I don't
fascinating because a lot of
remember.
those countries we're told to be very suspicious of.
Right, exactly. So here we are, and we're the people in the US, and it looks like who is protecting us from our own government is nations that we've been told are our enemies. Bolivia is not an enemy, but it has a leader who has some independence. And in any event, who are the enemies right now? I think we have to give up our prior ideas of right, left, wrong, right. What is liberalism? What is wokeism? And what are the things that are good for people, and what are the things that are harming people and families, education, healthcare, etc.? And we find that a lot of things we thought were the good things are actually, at the moment, not the good things. So countries that we were trained to think, some countries, not all of the 11, trained to think of as our enemies, are actually, in this case, definitely on the right side and saying we don't want the WHO and the UN taking over. And you have to realize the WHO and the UN are basically the US, Great Britain, Germany, and their industries. Those are the entities that pay for and control primarily what goes on at these international organizations.
Yeah, this is interesting. Alleged authoritarian regimes are actually rescuing us from authoritarian. It's a wacky world. You know what it probably makes you want to do? Drink. So, Dr. Nass, stand by for 1 second. Don't forget, a great way to support my work, especially when you're listening to everything Dr. Nass is saying and you're preparing for the end of the world, is to get 50% off some amazing wines and 50% off shipping of the wines if you sign up over at AllisonWinePromo.com. They have been with me since the beginning. Bonner Wine never tells me who to talk to or who I can or cannot talk to or what I can or cannot ask. They just help me stay in business every month. And the other best thing about it is that they're wines you can't get from the grocery store, and they are genuinely very good. I used to drink wines from remote regions at high elevations from Argentina. I said it online one time. They heard me say that. And they were like, well, that's exactly what we do. Would you like us to sponsor your channel? I said, that would be amazing. So they've been with me since the beginning, and they're great wines. They make a great present with a cause. You can call grandma up after you unfriended her on Facebook a couple years ago because she got the vaccine, you didn't get the vaccine, or vice versa. And, grandma's so much funnier with a glass of wine. So get her some wine for whatever holiday you're celebrating, and support my work while you're at it. You can also check out one of my new sponsors, Brickhouse Nutrition. Go to fieldofgreens.com, fieldofgreens.com, for 15% off your first order. Let's see if I can pull up the banner there. There we go. It's organic superfood powder. I have it right here. 2 scoops in a glass of water. Shake it up every day. It was physician formulated for specific organ function, immune function, everything. It's like all kinds of like spinach and ginger and just a lot of good stuff. And your garden's not working for you right now, like mine is completely dying. I have a terrible, I don't know, somehow I was able to grow a garden in containers from Home Depot in Washington State, and now I have like gorgeous compost in a huge garden in Florida, and I'm killing everything. I don't know if it's just because the animals here are freeloaders or what, and they're just eating all my stuff. But anyway, it's a great way to get some good nutrition if your garden is not up and running or you're going into winter or whatever, and it's a great way to support my work. Again, fieldofgreens.com. Use promo code Allison for 15% off your first order. And also, don't forget Twin Engine Coffee. I don't want to throw them out. I do have coffee too for your hangover after your AllisonWinePromo.com, but I don't have the screen up. So just trust me on this one. It's great coffee, high altitude from Nicaragua, light roast, dark roast. Didn't you say Nicaragua is saving us from tyranny right now?
Yes.
Okay, good. Another great reason. So go over to twinenginecoffee.com/Allison. Get some dark roast, light roast, espresso. I'm actually drinking the espresso with my raw milk latte right now. Great products over there too. Dr. Nass is going to take some questions over at AllisonMorrow.locals.com right now. You can be on my editorial board for $5 a month. Put questions in ahead of time for interviews. Go one-on-one with the most censored people on the internet. It's a great way to support my work as well. Dr. Nass, before we cut this on YouTube, tell everybody where they should follow you. I think you're on Substack and Twitter and everything. Where should people keep up with your workings?
Thanks. Yes, I have a Substack, merylnass.substack.com, @NassMeryl on Twitter, and I've formed a new organization that is really fighting all of this great reset, the UN and the WHO. Lots of information on there. Please sign up for the newsletter, doortofreedom.org. Thanks.
Is that a number 2 or TO?
No, TO. Thank you.
Okay. doortofreedom.org. Okay, great. All right. Well, thank you, everybody who's watching on YouTube. We hope we'll see you over on Rumble, Rockfin, or Locals.